Hello, everyone, and welcome. We will begin shortly. Thank you for joining this breakout session at the Safer Births Now virtual conference. Before we begin, we just have a quick reminder. Questions for the speaker can be added to the chat or the Q&A function throughout the session. We'll address as many questions as possible during the Q&A session or at the speaker's convenience. If you don't mind, please start to include your name and where you're located in the chat, and we'll get started in a moment. Hello, Lindsay. Welcome again, coming in from B More. And I see Valerie's coming from Cali. Sarah Hammond's coming to us from South Carolina. Happy Tuesday, Tamika. All right. Hello, everyone, and welcome to this session of the Safer Births Now virtual conference. My name is Ronitha Darrett, and I'll be moderating today's session titled Navigate Maternity, Smarter Tools, Safer Moms, Stronger Outcomes. The Safer Births Now conference brings together clinicians, researchers, innovators, parents, their loved ones, and advocates from around the country with a shared goal: improving outcomes for Black mamas and newborns. We're excited to have you join us for this discussion, and it is my pleasure to introduce today's speaker. Theodore James also goes by the name Thea. That's what she prefers. She is the Chief Operating Officer and co-founder of Navigate Maternity, a tech-enabled maternal health company improving outcomes through self and remote patient monitoring, care coordination, and community-based support across pregnancy and postpartum. Her passion for healthcare stems from her upbringing in Gary, Indiana, which her and I resonate because we're both Hoosiers, where she witnessed firsthand the disparities impacting Midwestern and BIPOC communities. This experience drives her commitment to advancing health equity and transforming maternal care. Thea also serves on the board of Birthing the Magic Collaborative, where she continues to advocate for equitable access to maternal health resources and support. I'm telling you, this is a presentation you don't want to miss. Miss Thea's personality is definitely going to draw you in while she educates you on a very important topic. Also, you definitely want to be engaged because this is not a sit and get type of interaction. It is very interactive. Please remember to use the question and answer option for questions you would like Thea to answer toward the end of her session and again throughout. Beyond this session, you can connect with Thea, and I'm confident you will want to connect with her after this. She is on LinkedIn, and you can find her under Theodora James. You can also connect with her company, Navigate Maternity, online through LinkedIn. Search Navigate Maternity. And the website is navigatematernity.com. And of course, on Instagram, you can find them at Navigate Maternity as well. And we will drop that all in the chat feature. We will also drop the website where you can purchase items that will be discussed today. And that website is shopnavigate.com. Again, it's my pleasure. And Miss Thea, the floor is yours.
Oh my gosh, thank you so much. That was such a wonderful introduction. I hope I live up to the hype. But thank you so much. And thank you everyone for joining. I see we have people from all over, so we truly appreciate your time. So let me share my screen and we can get started. Ronitha, are you able to see my screen? Is it
It is
loading?
coming up. Right now, it looks like it is now showing. You're good to go.
Perfect, perfect. Thank you so much. All right. So my presentation, as Renita said, is smarter tools, smarter moms, and stronger outcomes. I am the Chief Operating Officer of Navigate Maternity. We are a company based in Indiana, Fort Wayne, Indiana, to be specific. And before I go into the problem of why we started Navigate Maternity, what Navigate Maternity is, like Ronita said, this is an interactive presentation. We do have a prize, and it's essentially for moms, for pregnant women, for those that are in postpartum. But you can also play, do the quizzes because you are able to gift it to someone special. So please feel free to answer the quizzes. So it is a lag. So but it is coming up now. And as far as when we take the quizzes, you can either scan the QR code, but Ronito or Marie, I did send the links to each question. So if you could just drop it in the chat. I know I'm a phone person, so typically when I join sessions and webinars like this, I'm on my phone, so it's like kind of hard for me to scan. But if you could drop the quiz, if you have it readily available right now, or we can start with question two. But this is it normal or something more? So the first question, and like I said, you can scan it and you're going to just choose which one you feel as if is the correct answer, and then also put your name so that I can know who's filling it out. But I see that we're rocking and rolling now. So going back to which symptom is often dismissed but can signal something serious. So the first one is, since it's not on my screen anymore, it is a mild headache, that's A, swelling, fatigue, or all of the above. And I give a few more people time to answer. I see we have five. Okay, it's picking up, it's picking up. Give you all a few more seconds. And once again, the options are mild headache, swelling, fatigue, or all of the above. All right. And you all are correct. The answer is all of the above. And this truly is important because usually when moms go in, they're pregnant, when they're, swelling typically raises some type of issues. But if someone says, "Oh, I have a headache," or "Oh, I'm tired," it's usually brushed off because they're like, "Oh, well, you're pregnant." But no, that is not the case. All right. So going into the next question, not everything is normal. So this question it says is a lag. So give me one second.
And
More
I am
so
dropping it
focus.
in the chat. But
Oh,
yeah,
perfect, perfect. Thank you. So this is centered around preeclampsia. So preeclampsia most commonly involves high blood pressure, low iron, high blood sugar, or dehydration. What are your thoughts? All right, we have some high blood pressure.
I love seeing how many are participating.
Yes. All right, do we have any more? All right, and it's picking up. All right, so you all are correct. I don't know how I'm going to do this. This is going to have to be me selecting a name out of a
Everybody
bucket
wants
because
that prize.
right. So the answer is correct. High blood pressure. But this is a good topic because going into my next slide, so hypertensive disorders of pregnancy. A lot of people truly don't know. When I got into the business of maternal health, a lot of people did not know what preeclampsia was. They truly thought it was centered around high blood sugar. But preeclampsia is just a severe version of gestational hypertension. And gestational hypertension is high blood pressure that develops when a woman is pregnant after 20 weeks of pregnancy, but it's without signs of organ damage or protein in the urine. When it comes to preeclampsia, it's a serious multi-system disorder occurring after the 20 weeks of pregnancy, but is the characteristics usually include high blood pressure and signs of organ damage, such as protein in the urine, liver, and kidney dysfunction. So yes, you all are right. Both are hypertensive disorders of pregnancy. So typically when I show this slide, it's just like, oh my gosh, this is a bold slide because it's titled Mothers Are Dying to Have a Baby. But unfortunately, in the United States, this is an issue. Mothers are truly dying to have a baby. The US has the highest maternal mortality rate of any high resource company and country, excuse me. And unfortunately, Black and brown women die 3 to 4 times more than national average. And this gets into rural areas because the focus within the last few years in healthcare has been rural areas because a lot of moms just do not have the resources. And stats have shown that 60% of women are more likely to die from pregnancy complications if they live in a rural area. And unfortunately, 50% of rural counties rather, they lack OB services. So when it comes to all of the issues surrounded about by these three issues, it's just so crazy because per the CDC, more than 80% of deaths are preventable. And when you hear that number, it's just like, oh my gosh, wow, more than 80%. So it's definitely an issue that has been an issue since my mom had me, and I was born in the 80s. 89. But it's just so crazy that we're still dealing with this issue over 30 years. So where the system falls short. Here we are with another question. So the question is waiting for it to come up.
And while Thea is waiting, remember to submit your questions through the Q&A option so that we can have those ready for the end of her session.
Yes, please. Thank you for that. So how often are prenatal visits early on? So are they daily, weekly, monthly, or only when needed? So how often does one go to the doctor early on in their pregnancy? Daily, weekly, monthly, or only when needed? All right, we have a rock star team here. The answer is correct. It's monthly. So when it comes to monthly visits, especially after 2020, the preeclampsia as well as the hypertension rates have increased. So this is where Navigate Maternity focuses on the gaps in key clinical data that leads up to inadequate maternal care. So the first one that I want to touch base on is the no or limited clinical data between prenatal appointments. As you all stated early on in a pregnancy, a mom goes to the doctor monthly. Unfortunately, with the rates in preeclampsia as well as hypertension rising, is multiple touch bases are needed for the mom. So what do we do? This is another issue as far as the reactive versus the proactive patient care. So, and this not only stems around maternal health care, but unfortunately, the United States focus on a patient coming into the hospital, and then we're working on helping that patient overcome the issue that they had. But it's more so of why don't we focus on being reactive, making sure that the patient doesn't get to that issue versus trying to help them solve for the issue at hand. So reactive versus proactive patient care. Another gap is the limited social determinants of health data. So unfortunately, a lot of Black and brown people suffer for this because of them living in rural areas. So when it comes to limited social determinants of health, it's more so of access. Do they have access to education? Do they have access to food resources? Do they have access to transportation? A lot of women, especially living in rural areas, they are in OB deserts, and this goes to the fourth gap because a OB desert essentially is where a doctor is not readily available. They have to travel an hour, maybe 2 hours to get to the next OB. But unfortunately, if you're having issues and you have to go to the doctor right then and there, and you only have 15 minutes to spare, what are they to do? So OB deserts, they create a lack of access and delayed intervention. So are you all ready for the next quiz? So what if we could see more? So what improves early detection? Is it more visits, home monitoring, waiting, or Google? What do you all have? What improves early detection? More visits, home monitoring, waiting, or Google? We'll wait for the responses to start coming in. We have more visits. We have home monitoring. I guess it's a battle between more visits and
I
home
bet.
monitoring.
I'm glad Google hasn't popped up though. I'm really happy to see.
All right. So the correct answer is home monitoring. And it's so crazy, Ronita, that you said Google, because I will say my mother is a registered nurse. In the past, Google has been my best friend, and truly it still is. And ChatGPT, now we're switching to more so of
Right.
AI based. But I used to call my mom all the time, diagnosing myself. So make sure you all do not do that
Please
because
don't use Google.
but the correct answer is home monitoring. And while more visits is actually a great answer, because of course, who doesn't want to see their physician and their healthcare team? Unfortunately, when it comes to the hospital system, just in general, we're currently at a shortage of OBs as well as nurses. And a lot of people do not know that. So while more visits would be idea, it's not realistic or feasible for the healthcare team. So home monitoring. So let's get into the importance of home monitoring, especially when it comes to navigate maternity. So our company is a remote, we have two branches of our company. So we have a self-monitoring platform as well as a remote patient monitoring platform. Of course, in which both are home monitoring. And we also have a Navigate Maternity app. So the Navigate 180 is a blood pressure cuff that's validated in pregnant, pre-eclamptic, and postpartum women. And our blood pressure cuff connects to our app, which is called Navigate Her, and is available on through iOS as well as Google Play, so iPhones and Androids, in which the mom downloads the app and she can sync her blood pressure cuff to the app. So not only do we have a blood pressure cuff, but we also have a scale to monitor weight because that is also an issue when a woman is pregnant and as far as rapid weight gain. So we want to monitor that as well. And as stated with the gaps, the social determinants of health, the mental depression, making sure that those moms fill out different questionnaires so that we can truly gauge where they are within their pregnancy. So as I stated, the Navigate Her mobile app connects via Bluetooth to our blood pressure monitoring scale to enable easy health tracking and exporting to the care team. So when a mom is self-monitoring her data, she basically can download that report to either take it into her physician and her healthcare team, or she can actually email it as well through the app if they're having any type of issues. Our application also sends alerts to the mom. One thing when we first started Navigate Maternity, we ran into the issues of mothers and also myself not knowing the difference between a high blood pressure reading, a severe blood pressure reading, and a mild blood pressure reading. And we've realized that that is truly important to say, hey, mom, you have a high blood pressure reading, or hey, mom, when they have a high blood pressure reading, which is considered medium or mild, it's just more so of, hey, you need to monitor this. But if it's a severe blood pressure reading, it's just like, hey, you need to get this checked out very soon. So we have had moms thank us about the different alerts that we had. And as far as the Edinburgh Depression Scale or the social determinants of health, we do have work with community-based organizations in which if we see that a mom has a food insecurity, we help her and basically recommend her to different food banks, or we do have some companies that we work with that actually provides meals. So we do that just depending on what state we're active in. In Indiana, that's truly where we have those CBOs that actually provide the meals. Whereas I'm here located in Georgia, we just work with different community-based organizations to refer them out. So going to the next slide. So monitoring and accuracy gaps lead to poor outcomes. The reason why I wanted to highlight our blood pressure cuff and it being validated in pregnancy, preeclamptic, and postpartum women is because it is only two cuffs in the United States with that validation, and Navigate Maternity has one of them. A lot of people don't know that when it comes to pregnant women, it's very important they have a cuff specifically validated in pregnancy, because 66% of home blood pressure monitor tested had failed in pregnancy validation standards, meaning there has been times where a mom has went to the hospital and she's like, hey, I have a high reading, because she just went to a Walmart or Amazon and got a regular cuff, and they're like, your blood pressure isn't high. And it was because the blood pressure reading was inaccurate. And most standard BP monitors just were not designed to take the blood pressure reading of a pregnant woman. So it's very important that a mom has a validated cup.
Thea, if I may ask,
Of course.
based off so many people in our community having high blood pressure, and some are aware that they are to take their blood pressure cups into the doctor to get it calibrated. Some might not even know that. But with
Mhm.
your device, do you have to get it calibrated every so often?
You do not. And that's why we went through, and thank you for asking that question. As far as our FDA cleared device, it actually was calibrated beforehand, so it had to go through different testing. So ours is different. So it does take three readings, and what it does is take the average. So I will say that our blood pressure cuff does take a little bit longer to take those readings. It can take up to 3 to 5 minutes, but it already comes calibrated. Thank you for that question. But as far as closing the gaps in maternal care in the outpatient setting, so this is where the healthcare team becomes involved. This is more so of the remote patient monitoring. So as far as the Navigate Her is the application, the Navigate 180 is the blood pressure device as well as the scale, but we have a Navigate Pro. So this is our AI-driven electronic health record software that provides insights for clinicians through integrated telehealth, customizable SDOH screenings. We have the symptom trackers and the mental health assessments. As far as the automated alerts, so not only will the patient receive the alert, it will also go to the healthcare team, and we coordinate with the healthcare team as a whole. So as I stated, we have the community partners, we have the OBGYNs, the midwives, the doulas, and it's truly to ensure that everyone involved in the mother's healthcare is knowing what is going on. They're truly aware. So it's not like, hey, well, my OBGYN has this information, but my midwife does if they have one. It's literally staying connected. Everyone is staying connected. And it empowers moms to, give that information to reliable information to the healthcare team and to truly play a part in their decision making. We've had a lot of sessions, the Safer Births Now, and one of the sessions truly was centered around advocacy. And usually people just do not advocate for themselves, maybe because they're not knowledgeable, or maybe because they have a fear of saying something and speaking up. But when you have a system that you're using to track it, where it's just like, hey, I truly have my numbers and this is what's going on with my body at this point, is a good way to stay in touch with just everything that's going on.
And Thea, I'm glad you brought up about how it's for the sessions, it's been about advocating. And also, some of the sessions have talked about your tribe, your extended family, your church group, and things of that nature. When you say that your medical team can have access, how many people can have access to your readings? Because maybe auntie or grandma or grandpa, or even someone who is coming from church, you want them to be able to know your readings in case they have to act for you. How many people could have access to these numbers?
That is a great question. Honestly, and when you're signing up for the Navigate Maternity program, we do ask that question. Do you have anyone that you want to have access to this? And it's more so, to your point, a support group. So it's asking, who is your support team? So honestly, anyone can have access to this data. And even if you don't want them to have access to the data, once again, you can just send it to them via text message because you're just essentially exporting the information. But anyone can have those alerts. But that is, thank you for asking that question, because that's truly important as well.
We have another question while you go to your next slide. It looks like we have, would you consider your device an essential tool for doulas to have in their practice?
Yes, absolutely. These are amazing questions. We actually just started. My best friend, who's actually the CEO of Navigate Maternity, she's actually in a doula training right now in Indianapolis. I wanted her to join me today, but she couldn't because of the training. But I think it's very essential. And it's not just doulas, it's just everyone. One of our goals is truly to make Navigate Maternity like a necessity. When a mom is pregnant, they need a cuff, whether it's you're a first time mom, whether you're second time having a child, especially in postpartum as well, because a lot of the issues when it comes to preeclampsia and hypertension, they get a little intense after a mom has a baby. But yes, as far as doula care, just with doula care truly growing over the years and moms just truly leaning into their doula, leaning into that being the person who advocates for them. It's just, yes, the answer is absolutely. Great question. So Navigate 360. So I know we have a lot of tiers. So we have the Navigate 180. Once again, that's the blood pressure cuff, and it can come with the scale. If it's a Navigate Maternity Plus, we have the Navigate Her, which is the application, and then the Navigate Pro, which is the EHR system. But when it comes to Navigate 360, and we call it 360 because it's just the whole suite, the full suite of maternal care items. So we not only are we monitoring your hypertensive, your preeclampsia, your blood pressure, your weight, we're also the one-stop shop for your maternal care altogether. So we have compression garments, we have the breast pump accessories. So once again, the goal is just become the one-stop shop for pregnant women. So why this matters, and I knew this had to load, but I will say that we also offer educational material within our application. We've had a few, so we have a CMO. Her name is Dr. Elisha Harris, and she's an OBGYN in Indianapolis at Indiana IU right now. So she does have a few sessions that it just goes into details on explaining hypertension, preeclampsia, going to why it's important to take your blood pressure, especially for first-time moms. So going into the question of why this matter, how long do postpartum risks exist? So the first answer is pregnancy only, 6 weeks, 12 months, or labor only. How long do postpartum risks exist?
And Thea, while they're answering this, I'm thinking about all of the other items that your company provides. Are these resources that you see moms not only utilizing, but other people? You know, you said the compression socks and things of that nature. What do you see coming through as far as people purchasing your items?
So as far as people purchase, it's not just pregnant women. Typically, we've had a lot of husbands and boyfriends because we have shopnavigate.com, and we have a lot of people going on there buying the items to gift as well.
Mm.
So choosing on the website, you can choose a breast pump. you can choose those compression garments. We also have belly bands. What else do we have? We have a pregnancy pillow just to make sure that mom is comfortable. So just ensuring whatever that pregnant woman needs, we're hoping to have. But you can order it for a friend, a sister. It's something just happening. Are you all able, Bernita, are you still able to see my screen?
I am. Yes.
Okay, because it just went off. Okay, perfect, perfect. All right, so how long do postpartum risk exist? Yes, that is the correct answer, 12 months. And as of, I want to say 2023, when it comes to health insurance covering postpartum, having postpartum coverage, they did extend the coverage to 12 months after realizing that a mom does truly go through issues within the first year of giving birth. So breast pumps and things of that nature, the compression garments, they can also cover the blood pressure cuff. So that can be covered through your insurance up to 12 months postpartum. So why do we have everything? Why do we want it to be a one-stop shop? So it's basically supporting the mom through every trimester. So once we have the diagnosis during your first trimester, that's where you see a lot of the swelling. So that's why we have the compression socks and of course the hypertension classes and the resources and doing your SDOH and Edinburgh assessments. The second trimester is when we get into the glucose readings. And right now, we do not offer actual glucose monitoring, but in our Navigate Her application, you do have the ability to log that information, as well as the diabetes just tracker. And we have those type of resources as well as class. So when we get to the third trimesters, that's when we're gearing up for postpartum. So it's a matter of the mom ordering her breast pump, ensuring that she has her C-section kit. And that's when it comes to the compression garments as far as the belly bands and things of that nature. And then just making sure we stick with that through postpartum.
And Thea, we have a question from Gabriel,
Mhm.
and I hope I'm pronouncing that right. The question is, with Medicaid, is it only in certain states?
Great question. So as far as the Medicaid coverage of postpartum 12 months, no, that's every state.
Along the lines of insurance, because we've talked about this in other sessions, say your insurance provider is pushing back on approving these. Have you seen that? Have you seen where most insurance providers are covering this without any resistance?
Yeah, we haven't had any issues. And I will say so on our website, we have an eligibility form. So once a patient fills out our eligibility forms, what we do is take that to the physician, just letting them know that, hey, your patient is interested in a Navigate maternity kit. Now, one thing about the our kit and our blood pressure kit is that if a mom has already gotten a different blood pressure cuff through her insurance, they won't cover another one. So they cover it like if you had a first pregnancy, your first pregnancy, and you got a cuff, and then you're pregnant again, and you want to get another cuff, you are able to do that, but you cannot get multiple cuffs within the same pregnancy. But we haven't had pushback. If a patient truly wants a blood pressure cuff, in which a lot of OBGYNs, they advocate for a patient to get a cuff. So yeah, no, we haven't seen any pushback on the cuffs. So when it comes to outcomes and evidence, and this is just more so of what we've seen on the Navigate Maternity. Right now we have 70 OBs and cardiologists. Right now we're at 32 sites of care, and it's surprising that 48% of our clients and the patients, they are Medicaid moms, in which this rate is continuing to grow. So that's why it's just very important that we get the word out, especially getting in those rural areas when it comes to home monitoring, considering the fact that these are the individuals who don't have that easy access to their OBs. And some of our case studies, as far as the home monitoring, going back to why home monitoring is just so important. We had a key case where we had an acute heart failure at 7 days postpartum. And this patient had no prior hypertension history and Navigate's blood pressure reading and the weight gain flag truly helped this mom get the help that she needed. And she was just very thankful. And once again, she called her healthcare team. And one of the things that they stated was, hey, you know, you're pregnant. You just had a baby. Well, you just had a baby. You were pregnant. You'll be okay. And it's good that to have some type of system to ensure that you're able to advocate for yourself. Like, this is not normal. And I think that needs to become more so of a thing where people are truly stating, like, hey, I'm doing the work on my own, and I can tell you, no, something is wrong. So the final question is, why is loading? Let me go to it. And this is centered around Navigate Maternity. So what is the biggest benefit of Navigate 180 and Navigate Her? So it's more paperwork. There we go. Earlier detection, fewer providers, or less engagement.
And while they're answering that, I'm going to continue to talk about our tribe. When you said, making sure you advocate and you have people surrounding you, that is a theme that we've been talking about these last 2 weeks for the virtual conference. You want to make sure, and I know the doulas that are listening in, the mamas, the aunties, all of them have heard that, and we want to continue to share that. So, Thea, thank you for bringing that up.
Of course, advocacy is just, it's so important. I have been around people, especially when you're pregnant. It's like you don't have the energy to sit here and go back and forth. And it's not necessarily going back and forth, but it's like sometimes you just don't even have the energy to speak up for yourself. So to your point, it's good to have that support system, in which some people unfortunately don't. But when you have tools to assist you in advocating for yourself, it just makes a big difference. All right, so this was our last question, and you all are correct. Earlier detection. So that is all I have. Please, and I know we've been interactive during the presentation, but please feel free to drop some more questions in the chat. And thank you once again, Ronitha, for the interaction, helping me with the presentation. You were amazing.
Well, you were amazing. And while we wait for people to submit questions through the question and answer option, and please feel free to do that. I know Thea did a wonderful job explaining the device and all that Navigate Maternity provides. But I do have a question that I thought about. You had mentioned about the meals and how that is also part of the support plan. We are hearing that as a theme, making sure we have healthy eating habits and nutritious foods for our energy level that you also mentioned. So can you go into a little bit about the types of foods that are provided through that service?
Of course, of course. So it's truly depending on what stage the mom is. And it is we have a broad selection because it's dependent on if a mom is gluten-free, because we have some moms who are gluten-free, we have some moms who are vegan, some moms who are vegetarian, and of course those who eat meat like myself. But it's just dependent on truly what the mom wants. So one company that we're working with based out of Indianapolis, what they do is provide, I want to say it's because they provide meals for the family as well. So it's not just for the mom, it's for the family as well. And they get, I believe, 15 meals per month. And like I said, it's a matter of them just choosing which meals they want. And of course, that's not everywhere. But as far as the food banks, when it comes to working with different community-based organizations, they do work with the mom to see what type of meals they're interested in to help them find the food banks and so that they can get those items.
Wow, that again, wrapping that support around the entire family, so mama or even dad don't have to prepare those meals. Uh,
Yes, and to piggyback off of that, another thing that our system does is we actually give the community-based organization access to our system as well. So they won't have the screenings only if the mom wants them to have that information, but it's just more so of them having the SDOH in Edinburgh. But the healthcare team has access to that information as well. So they see what type of care that they're getting outside of just their from the clinical clinical setting. And that's one of the issues that we run into. They're like, we refer them to a community-based organization, but we don't know what's going on. So we do have the community-based organization provide a report in our system so that the healthcare team, they're updated on what's going on outside of the clinical care.
Okay. Another question that we have, as far as moms and dads and whoever is assisting mama with taking her blood pressure, is there anything, technology is not something that all mamas are used to. And so
Right.
is there any barrier that you see that the doulas or OBGYNs need to be mindful of when utilizing this device, that you can go ahead and say, we have noticed this. These are the questions that we're getting when someone is starting this for the first time?
Yes, great question. One of the things that I do see often is, of course, Wi-Fi. So with our device, it does sync to the application, but and it's a matter of what if a mom takes their blood pressure and reading right now, and for some reason the Wi-Fi is messing up and it doesn't sync to the device. And let's say that can happen for up to a week. Like let's say the Wi-Fi is down for a week. But our device does, it stores up to 180 readings. So once you are back online, you are able to export that information to come into the app. So as far as education, so when a mom, we do provide thorough education on more so directions when it comes to uploading the blood pressure readings to the app, because it is really simple. But to your point, a lot of people, when it comes to technology, you just never know where they are. But it's literally simple. So we don't make it hard. Once you open, and this was just a matter of our software developers making sure that once you open, and I actually have it right here because I'm like, I keep hitting it. But once you put the batteries into this device and you turn it on, it literally automatically pops up to sync with the Navigate when you download the Navigate Her app. So it's not like I mean, you have to have your Bluetooth on, but it's not a matter of you having to go to the Bluetooth and just having to walk through multiple steps. It's really just once you turn this on, it connects. But I have this right here because this is actually the gift. And this is a Navigate 180. So I am based off of your questions. I'm going to see who won. And Ronitha and Marie, I may need your help to like pull it out of the hat because we had so many people answering the questions and you
Yes.
all were getting the answers right. And I truly appreciate your engagement with that. But I will be sending out a kit to the winner. So I will get your email address. So please be on the lookout for an email from me because I will, of course, request your address so that I can send you this. But I will get that information out tomorrow.
Okay. Continue to submit your posts or your questions through the Q&A session. In a moment, we are going to end our Q&A. So again, continue to send those in. Another question, you continue to talk about the rural families and being in a medical desert. And in the Black and Brown community, we know about deserts, food deserts, medical deserts, things of that nature. Can you elaborate on moving moms that are always on the go, and the benefits of this? The moms who's always on a plane, pregnancy does not stop her, she's always on the move. How does this benefit that mom, that active mom?
That is a great question. And of course, we do have some of those. And actually, and I gave you all a case about the mom who had the almost a heart failure. And she truly was a mom who was on the go. And that's why she was just like, I called and they told me that I was okay. And I was just like, okay, I'm fine. And she just stated, I am so happy that I had your device. Because when it comes to it, and I can actually pull it out because it's really a small cup. So moms, you can take this, you can travel with our cuff. Like it's, and I have mine. I don't know. I have to send you a picture because I have one of
There it
these.
is. Yeah,
Okay, you can see it. But
yeah,
it's
a
very
little
small.
bit. There you go. We kind of see.
Okay, because I'm like, it's very small, so you can travel with this device, but it's just important, just in general, when it comes to taking the blood pressure, your readings, we ask that you take it twice a day, once in the morning, once at night, and of course, for moving moms, we understand that this can be a lot, so we at least that you ask that you take it every other day, every day or every other day, if you cannot commit to the every morning and every night, but once again, it's better than going in to the doctor and being touched once. And it's very important that you do so because you just never know. Blood pressure, it fluctuates. So as far as those moving moms, as far as those in the rural, when it comes to home monitoring in general, it's just an additional step, an additional assistance to getting those blood pressure readings sent to your healthcare team.
Okay. Thea, we want to just thank you for all that you have shared. Before we wrap up, are there any other last minute questions that we would like to ask Thea? I'm looking at the chat. I see a lot of thank yous.
I do, but I can't type fast enough.
Okay. Yes, Marie.
Sophia, and I may have missed this when I was trying to do the questions and things, but mom is using the cuff prenatally. Would she continue to use it postnatal?
Yes, ma'am. Up to 12 months. And that's going back to why CMS extended that coverage because we have found that issues come up. They present 12 months postpartum. So absolutely. Now, granted, we do tell the moms to go based off of what your physician is requiring you to do. Typically within the first month, they're asking you to take it seriously, take it twice a day, every day. Then within the third month, it goes back to, take it once a week, but you definitely should monitor yourself up to 12 weeks postpartum.
Any other last minute questions? While Thea was answering those questions, I started to see the love coming through the chat and the emojis. Keep sending her the love while I give you some additional information. Thank you, Thea, for sharing your inside expertise and time with us today. I knew it was going to be a phenomenal session when I first met you. Your perspective has added so much to this conversation. The resources that this provides to mamas, families, there's no words to put with it. Those joining can go to shopnavigate.com to purchase all the items that Thea did reference for Navigate Maternity. And thank you to everyone who joined us this session, engaged in the discussion, and submitted thoughtful questions, along with engaging with Thea. We have a hard decision to make as far as who is going to get this wonderful tool, and that's a good thing. We are grateful that you have spent this time with us. The Safer Births Now virtual conference is made possible through the support of our title sponsors and program partners, whose commitment helps advance safer maternal and newborn care. We extend our sincere thanks to our title sponsors, Birthing the Magic Collaborative. And while I'm saying these sponsors, give us some love in the chat for these sponsors, because without them, it is nothing. We are not who we are. Black Coalition for Safe Motherhood, Transitions Women's Health Consulting LLC. And we are also gratefully acknowledging our program partners, Navigate Maternity. Miss Thea just talked about the wonderful resource that they are providing. A Light After 9, Chi Ada Phi Sorority Incorporated, Herd App, Hive Impact Fund, and Cadence Advisory Consulting. Last, we extend our sincere thanks to Your Village Studio for their outstanding technical and administrative support. Together, these organizations help strengthen education, connection, and innovation in support of Safer Births Now. Together, they help strengthen education and all the things we do. We do have a rich lineup still of sessions, even scheduled this evening. So throughout this conference, we want you to make sure you are engaging with us, inviting others to join us. Please visit the conference website to explore what's ahead and make plans to join the sessions that speak to you most. And even if you can't attend, send this to someone else who maybe can attend. It's all about advocating, spreading the word, and getting people to understand the things that they don't already know because people are not telling them. We encourage you to continue the conversation on social media using hashtag #SaferBirthsNow. And then also follow at Safer Births Now for updates, resources, and upcoming events. Thank you again for being part of this. Continue to reach out to Thea. She is a wealth of information, and her community and the movement towards safer, sacred childbirth. Enjoy the rest of the conference.
Thank you, Ronitha, and thank you, Thea. And I just want to remind our doulas that this workshop does provide an attendance certificate. I dropped it in the chat. You can email us at hello@birthingmagic.org, and we'll send you the certificate. Include the name of the session. And if you're doing multiple sessions, just say I attended all of them. But we do have a list of whether you're here or not. And then the next session that we're doing with Dr. Cassandra Henderson will provide CEs for nurses, as well as the doula certificate. So we'll see you in about a half hour, 7:30 Eastern. Oh, and then there is an app, Thea, that I can send you so that you don't have to draw the names. You drop the names in and it spins it or whatever behind the scenes. So that way no one says we're showing favorites.
Exactly. We're not biased at all.
Not at all. But thank you guys. Have a great night.
You too.
Thank you.